University Health System. It is great to have you out here today as we announce one more extension of healthcare services to the residents of Columbia County. Many Columbia County residents have likely already taken advantage of our online COVID-19 virtual screening and perhaps may have been screened at the collection site at Christenberry Field. However, in working with folks here in Columbia County, we wanted to ensure that the residents of Columbia County had the opportunity for specimen collection closer to home. So we brought the team that we introduced you to at Christenberry Field today. Dr. Philip Poole, our Chief Medical Officer, and Mallory Myers, our Chief Innovation Officer, are here with us today and talk a little bit about the screening process that we will begin as early as tomorrow. So I'll turn it over to you guys and then we'll take some questions.
So essentially this is using the same screening process of using the online app to conduct a telemedicine screening with one of our providers, whether that's a nurse practitioner, PA, or physician. And then if they determine that the person is appropriate for testing, this will provide an additional opportunity to get testing closer to where the person lives. People that live north of Columbia County and for those that live in Columbia County. So we're extending that as a collection point to make that more convenient for the citizens.
And we are here at Patriots Park. So for those of you who are not standing in front of me and didn't drive here, I want to be clear about where we're standing. This is a beautiful facility and very accessible. So we're very excited that we could set up our tents here, especially on such a rainy day. Mallory, you want to talk about the process?
So daily from 3:30 to 4:30, we're going to start with that time range, and then as our volume increases, we'll expand. But patients will be called as they have been once they've been virtually screened, and we'll give them the option to come to Christenberry Field or to Patriots Park to actually have the testing completed. So we're hoping that it's just as efficient as Christenberry and that we're serving the citizens of this area, being a little more geographically located.
Very important to emphasize that you don't just show up for a test, that we need people to go online and do the screening first. And then if it's appropriate to test that individual, not everybody needs to be tested, but those that do need to be tested, this will be a convenient way for that specimen to be collected closer to where people live here in Columbia County. Right, so we're focusing on testing high-risk individuals right now. Testing capacity, although we're very blessed to have a testing capability that most communities would be very envious of, it's still limited. We can't test everyone. And so we are prioritizing those higher risk cases for testing, but as testing becomes more available, we will certainly expand that. But it is important for people to understand that not everyone needs to be tested, even if they have symptoms consistent with COVID-19. Yeah, so obviously we would love to have an additional 100 beds or an additional 100 beds in this area that we could use for COVID-19 patients. Particularly with the design that we've proposed at this hospital is they're what's called universal beds. So they're beds that could be used for ICU capacity, which is the big constraint with COVID-19 patients.
Or will be in the future. Right now, the majority of patients are at home. And so if we can't flatten the curve and those patients do need inpatient care, that's when the residents of Columbia County will really be most impacted. I will say I continue to be in contact with the other two Augusta hospitals, and we all together have 59 patients that are under investigation as inpatients in our facilities. Luckily, we only have 15, but as most of our screening, because we have the screening capacity and the collection that we've had from Christenberry Field, our labs are running reports and results. So of our 17 patients that have been confirmed as having positive for having COVID-19, only 2 of those are inpatients in our facilities. So most patients do go home and are isolated at home and don't need inpatient capacity. So we'll be ready for that. We're preparing for surge. As I talked to the other facilities today, we're all trying to figure out what do we do next when it continues to get worse and when it continues to be more prevalent. But right now, if we can use these kinds of specimen collections, run these through our labs, and continue to have everyone to isolate at home when they are found to be positive, we really feel like we can bring down the need for inpatient hospital stays.
So again, just to reemphasize what Katrina said, right now we only have a couple of patients in-house with COVID-19. So we're not in a difficult spot yet. We have lots of capacity within the system right now, and we have, for example, stopped doing elective surgeries as a way of creating additional capacity within the system. Again, still would be nice to have a facility here in Columbia County, but right now we're in a pretty good position, and certainly just looking forward for what we might need in the future.
And really surge planning, I think that's really the buzzword that's going to be the next social distancing, is surge planning, and that's what the other CEOs and I, and particularly our teams, are thinking about. Where would we go when we needed that additional capacity? So whether it's beds, we want to avoid stretchers in the halls, so we are looking to create internal capacity as overflow surge. So in a period of about a week, we hope to have a 24-bed swing unit that we could use for overflow. So we're really looking for opportunities so that we can quickly react and respond. Most of what we've seen nationwide is this doubles almost every day or every 6 days. And the experience in Georgia with the additional testing has been that. So again, we want to keep as many people out of the hospital as possible, keep the less acute out of the hospital so that we can preserve our beds, and particularly our ventilators, which are going to be in such high demand because of the respiratory effects. And look at me going clinical with a nurse and a doctor on either side being flanked. But really those respiratories are going to be the other piece that will be in high demand, and not only here locally, but is becoming a problem nationally.
So right now, citizens of Columbia County, and in fact, if you look at a map of where people have been coming for testing or have been screened via telemedicine, via our systems, it is a large portion of the state, and also a large portion of South Carolina are using the system to access that screening now and are coming to the drive-up testing. So this is simply moving some of that to make it more convenient, and likely won't result in a large increase in the number of people that are actually tested. It'll just make it more convenient for the citizens of Columbia County and surrounding area. Additionally, we're working aggressively to increase our lab capacity. We're doing that as rapidly as we can, and are very optimistic that we will be able to increase our lab testing capacity very soon.
And when that happens, that could happen very rapidly. And some of the new FDA instruments that are being rapidly deployed, and the reagents, if we were to get those, we want to be ready to work down our backlog very quickly. And with having collection sites like this, it keeps people out of the emergency departments, out of their physician offices, and lets them know that with a 2 to 4 day turnaround, they're already going to be in line. And so we want to make sure that those specimens are being collected and would be ready to be acted upon whenever those instruments and reagents become available in our area. We're actually in a pretty good spot in regards to PPE, where we are aggressively encouraging our staff to make certain that they're frugal with the PPE, and yet we've gotten a large donation of masks today from Home Depot, which we very much appreciate, and others in the community are donating masks and things like that. Again, that they're appropriate masks. And we're appreciative of those donations when they occur. We're in a pretty good spot right now. I don't want to let up
our guard on that. We want to remain very cautious about how we use our PPE, but right now we're in pretty good shape.
And we don't need to start naming individuals. It's like thanking people who have brought us to this point, for all of those individuals within the community and those corporations that are really stepping up to help in any way that they can. Some are big projects, some are small. Many of those are relative to the size of the business, and so we really welcome all of the support that we have gotten from area businesses, some very local, some very national, and so again, we appreciate that support. Again, you know, it's a fine line in balancing our personal protective gear and making sure that caregivers feel safe without overusing. And one of the other things that I've spoken with the other CEOs about is for these persons under investigation and awaiting test results within our facilities, when you have a lot of inpatients, you can go through a lot of PPE. And so there's a keen awareness among us for those suspected inpatients of having the virus and utilizing too much PPE before we can discharge them safely and appropriately to other locations. So again, a real need for having those reagents so that we can run those tests not only for Augusta University Health System patients, but really doing the right thing for our community and the other hospitals locally.
Well, you've certainly seen a sharp rise in the number of positive cases. Some of that is the testing results catching up with the reporting, right? And we've known that to be the case. As we test more people and as we clear out this backlog, you might see a sharp rise in the number of cases. That doesn't necessarily mean that there's a new problem. It's just a new confirmation of what we knew the problem was, right? So we've got to be careful about how we interpret the numbers and make sure that we don't panic over those. We are doing everything right to bend the curve, so to speak. So the community as a whole is doing all of the right things. So we have to continue to do that. We have to continue to practice social distancing. We have to continue to practice good cough and sneeze etiquette, hand washing, hand sanitizer use, etc. Yeah, so just because you're not aware of it doesn't mean that the problem isn't there. And that's what I was referring to, is there is a testing phenomenon here in that everywhere we start to test, we find this. So that's why it's so important that we are careful, even in those areas that don't have confirmed cases, that we don't let our guard down and continue to heed the warnings to practice all of those measures that we're talking about to control the spread. So again, we're in uncharted territory, and I appreciate the challenge that community leaders are facing. These are tough calls that there's no good playbooks for, right? So they're very difficult decisions to make. Both the approaches, for example, taken by the leaders of Columbia County and by the city of Augusta are based on the risk in those communities, right? We have a lot more bars and restaurants in downtown Augusta. So a measure that controls that versus asking for voluntary compliance within Columbia County are two different approaches in both of them. Right, so we're following, and as a community, we have agreed upon an approach with guidance from the Georgia Department of Public Health and the CDC about who should be tested, and it's who is higher risk and who should be the priority for testing. People do not all have the same risk with this disease, particularly pediatric patients, for example, are much lower risk than are adults. Adults with chronic medical conditions are at higher risk. And so, again, we have to balance the testing capability with those at highest risk for having a bad outcome from this. And that's why we can't just test everyone. Even as frustrating as it is, we would love to be able to test everyone, but it's just not possible given the current constraints.
important that they have an appointment because, you know, the virtual screening process is online, and the positive screenings are what drive people to get scheduled for the appointment. So having the appointment actually tells us that they've been positively screened, and it helps us to make sure we have the right resources here to collect the specimens for those that are scheduled and that have the positive screenings. You are going to go to our website and launch the virtual care app and select a provider that will be available to see you, and they will ask you some questions, and depending on how you respond to those questions and depending on the visible interaction you have with the provider, they will communicate with our registration team, and we'll call you and get you scheduled to come for a screening, and we'll offer both locations, Christianberry or Patriots Park.
Right, so we know from some of the evidence that's out there, we can predict within reason who is at higher risk. Just because someone, for example, may have symptoms consistent with COVID-19, given certain factors about that person's medical history and how they're doing, that person may be able to be treated at home. Again, the vast majority of people can be treated at home and do not need to be hospitalized. There are a group of people that are higher risk and need to be hospitalized, and again, we can predict that within some degree of certainty, but certainly anyone that becomes ill enough can come to the emergency department. We prefer that people notify in advance, especially if they are under investigation for COVID-19, that they would reach out to their emergency department and not just show up unexpectedly, because that creates additional potential exposures for others.